So Catherine came to me with a really common complaint that we get all the time from ladies, which is these little lines that are just above the lip. But treating them in isolation is not usually that effective. To rejuvenate this area, we normally have to look at not just the lines above the lip, we need to look at what's causing that, which is a bit of volume loss around the edge of the lip, and also the droopiness that we're starting to see in the areas around the mouth, especially here at the jowls, the nose to mouth lines and the marionette lines. So rather than just filling into these little lines, we're going to do a more comprehensive rejuvenation of that entire region. So I'm going to start off by restoring some of the vertical height to the chin, which is going to help us to improve the jowls. We're going to really soften these folds here and here. We're going to do the tiniest little bit of lip augmentation using a really soft filler just to restore the volume that's been lost. And the combination of doing all of that is really going to soften out these lines. And then at the end, if there's a few little fine lines that are left, we'll pop a wee bit of filler into there. But that's where we go to last rather than first. So Catherine, if you just have a wee lie back for me. Fantastic. So I'm going to use 2 volumes to start with. Thanks. So just turn ever so slightly that way for me. Thank you. So a wee scratch just here. How was that? Good. And then we're just going to pop the cannula in, which will feel a bit strange. And it feels, you can feel the movement under the skin, but it shouldn't, he says, be painful.
Yeah, that's good.
Good. And then we're going to top up this area here. You all right?
Mm-hmm.
Can I get you to sit forward for me for 3 seconds so I can see? Yeah, let's look in there. Good. And just have a wee lie back for me. So now I'm going to soften these folds. So now I am just filling the nasolabial fold, and to do this I'm going to use a little blunt cannula, which allows me to access the entire fold from one entry point. There is a little blood vessel that's not a million miles away from here that I don't want to touch. So I'm just going to give it a little aspiration in the needle first, just to make sure that we're not sitting inside that vessel. And then I'm just going to start infiltrating a nice slow volume, as little volume as I can get away with, of a sort of medium thickness consistency product. And then the same again on the other side, obviously. We've restored the volume a lot around the mouth area. That's helped us to improve the jowls, lift the corners of the mouth and soften these lines. Next, I'm going to just add a little bit of volume and definition to the edge of the lip, just to restore a more youthful shape. Then we'll see what happens to the lip lines if we need to do anything there as well. Okay, so the technique that I use for injecting the lips is quite unique. I inject perpendicular to the lips rather than along inside. You see that slight increase in volume that we've just had over here. Okay. There we go, a little bit more over here. Again, we're injecting perpendicular to the lip so that we get a nice smooth flow. That gives very minimal augmentation, because what we definitely don't want is big sausage lips. Sausage lips are never good. And she's smiling while she's getting it done, so that's always a positive. Okay, so now that we've got a sort of nice little bit of definition and volume around the edge of the lip, I just want to go directly into the white part of the lip, i.e. the bit above the lip, and just add some really small amounts of volume to help soften the fine lines. And then I'm going to sort of just any little fine lines that I can see around the edge of the lips and the corner of the mouth, I'm just going to tighten those up with, again, really small amounts of really soft filler. We've done all the structural stuff. This is just the sort of refinement stuff that comes at the end. I'm just putting a few wee drops above the lip. Mm-hmm. Soften some of those wee lines. So again, these are really, really tiny volumes of a really soft product. The lips always swell more than any other part of the face, so it's normal for them to look a little bit puffy like this, but when we see Catherine in 2 weeks, there will be no sign of any puffiness. And that does.
Oh my god, what a new person. Jeez, oh Lord.
Does that look a bit better?
Yeah.
So lines around here, all softened. Lip, tiny little bit more volume in there.
Yeah.
So right now it just looks a little bit puffy. Don't worry about that, that's going to go in a few days. Jowls looking a bit smoother. This all just a bit lifted.
Oh god, that's amazing. Yeah.
Fabulous. Good.